Welcome to your nuclear cardiology test. So you've been booked for a nuclear cardiology study either because the doctor felt initially at your consult that a stress test just wasn't enough and they needed something more sophisticated, or because your stress test didn't go as well as we would like and the doctor wants to do more testing on the heart. So remember that you're going to be coming over 2 days, so day 1 for your stress portion and day 2 for your rest portion. So stress, you've arrived, you check in with the receptionist, and you have a seat. And once you've done that, one of the technicians is going to call you in. So come on through the area. Let me give you a little tour of what we have behind the scenes over here. So the nuclear area is actually quite a unique area. And as I mentioned, it's a partnership between Sierra and EFW. And what we do here is we test the heart. We inject radioactive dye and see where the blood is going. I also mentioned that EFW is the radiologist, that they're a large radiology group and they also man the Foothills Hospital. Now, in this facility over here, you have the hot lab. This is where we have radioactive isotope and we manage it. So as you can imagine, we have to handle this isotope with care. We have an IV start area. Come on into the IV start area. So when you come here, you'll have your IV started over here. I should mention that our technicians are very good at starting IVs. This is what they do day in, day out, is they start IVs. But of course, if you are a difficult IV, do let them know and they'll use extra special care to see what they can do. Once you've had your IV introduced, then often you will have a seat in the waiting area. And then once your time is ready, you'll be brought into the treadmill area. So come on over. So, here you are in the treadmill area. Now, the treadmill area is an active area. There's a lot going on over here. First of all, we'll have people having their regular treadmills on one side, but then we also have areas that are designated for nuclear treadmills, and you'll notice the radiation sign that helps us identify those sites. You'll come over here, and you'll have a seat, and the technician will talk to you. They'll talk to you about the risks associated with doing this test. They'll ask you if anything's changed since you were last here, and then they'll start prepping you. They'll prep you just the way we did the last time. What they'll do is they'll take a little bit of sandpaper and they'll exfoliate the skin, then they'll take a little rubbing alcohol and clean the area. What that does is it gets rid of the old dead skin that can act as an insulator and prevent us from getting good tracings. Then what they'll do is they'll put the electrodes on and attach you to a little belt and a little device that'll monitor your heart rate. They'll program the necessary information into the computer and they'll get you ready. So once you're ready, they'll get you on the treadmill. So you're walking along on the treadmill and you're starting at a nice easy pace. Once you're comfortable, the technician will say, all right, ready to start the test? And you say yes, the first stage will start. The treadmill will go a little higher, a little faster. And every 3 minutes, you'll go a little higher and a little faster. And our goal is to get your heart rate at minimum to 85% of your maximum, but ideally to your maximum heart rate. Now, what we want to know is you'll have the cardiology technologist or the healthcare provider on one side, and you'll have a nuclear technologist on the other side who will be manning the IV. And what they'll say to you is that when you have 1 minute left in you and you can't go any longer, let them know so they can inject the dye. So you're walking along on the treadmill and your heart rate's hit your sub-maximum heart rate, and you say, okay, I've only got a minute left. They inject the dye. You keep walking for that additional minute. Once that minute is done, they stop the treadmill and you're brought over to the waiting area where you have a seat and where you sit here for 5 minutes in the recovery phase. And what you do is you wait here. They're watching the heart tracing. Once that's all done, the technologist will take off most of the stickers. They do leave some of them on, and they'll send you back into the nuclear waiting area. So, in the nuclear waiting area, you will come to a separate part of this clinic, and you will have a seat over here in the corner. We try to keep patients who have received radiation from patients who have not received radiation apart, just for safety and minimize radiation exposure. So you'll have a seat over here. And while you're sitting here, a good chance to just relax. You'll be waiting for a few minutes, grab a magazine, read a book. Once time is ready, one of the technologists will bring you in to where the gamma cameras are. So we'll head over here. So the gamma cameras that you have are very unique cameras. What they will be doing is they'll be testing where your blood flow is going in your heart, and making sure that the blood is going where it should. So the gamma cameras themselves are really quite unique. You get to lie down under the gamma camera and the machine will come over you and it'll look at the radiation in the heart. You'll be in there for about somewhere between 10 to 15 minutes. Once that's done, test is finished. And you're all set then to head off home and come back for the next day for your rest set of pictures. Now the rest day, easy. You show up, check in at the reception desk, they'll give you an injection, you have a seat, wait a number of minutes, and then when they're ready, they bring you in and you get to lie down under the camera again and get your pictures taken. Now what's going to happen is that these images are going to be sent over to the nuclear radiologist. And the nuclear radiologist is going to compare your images with stress and your images at rest. And they're going to say, look, the blood flow went to these areas when he was stressed or she was stressed, and they went to these areas when they were rest. Maybe there's an area that wasn't getting blood that it should when you're under stress, and that would suggest a blockage. And that's useful for us. Once we at Sierra receive this information, then we'll connect with you. If the test is normal, we often will call and give you the results over the phone. If it's abnormal, then you will be brought back to see us. I should mention that a copy of these test results go to your family doctor and will be there within a week of the test.